consequential to economic austerity. I think what's happening in Gaza and the medical crisis that is ensuing is part of a systematic attempt to complete genocide.
We love the fact that you love freedom.
Welcome to another episode of our series. Today we talk about the pharma industry and how it is all for the benefit of human species and the planet, or not. We don't know, to be honest, but fortunately for us, we have Letizia Bonanno as a guest today, who does know a great deal about the topic. So we will find out shortly if our guesses are totally wrong or if they hold. A few years ago, Letizia conducted a research in Athens on the topic of care in times of crisis. She looked at how people organize in a situation where the state collapses under the pressure of capital.
Letizia Bonanno is a social anthropologist and artist. She earned her PhD in social anthropology from the University of Manchester in 2019. Her drawings became a mode of ethnographic translation that often accompanies her research and is present in online books, designs, or exhibitions. Welcome, Letizia.
Thank you for this invitation. I'm very pleased to share this time with you, and I hope I can answer or at least contribute to your questions about whether or not pharmaceuticals are actually good for humans and plants and animals, maybe.
So, Letizia, let's plunge straight into the subject. Can you describe in a few words how the pharmaceutical infrastructure evolved into this industrial complex that is today?
Okay, so first of all, I'm not an expert in big pharma issues, as you rightly mentioned in the introduction to my work. I am a social anthropologist, I am an ethnographer, and my insights into how pharmaceuticals have become or are the potential to become an infrastructure of care are very much bounded to my research field, ethnographic research in Athens. I did my fieldwork, my research in the Greek capital city between 2015 and 2017 at the peak of the so-called economic crisis. And as Valentin mentioned again in the introduction, at the point the welfare state was on the verge of collapse, in the sense that the austerity measures that were imposed on Greece implied a very drastic curtailment of welfare services, and the public healthcare system was the one and the first to go in a way, and it started being slowly privatized. At this point, and this is what medical anthropology literature somehow points out, when access to public health care services or to general public to healthcare shrinks, people start relying more on pharmaceuticals because somehow it's quicker, it's cheaper to go to a pharmacy and get a medication rather than paying for a medical consultation or having to be put on a long waiting list. In the specific case of Athens, I looked at how people self-organized, to say better, organized these grassroots medical facilities where voluntary doctors and more general volunteers were providing some sort of primary healthcare aid, and mostly were giving and distributing pharmaceuticals for free. So this is more or less how I understand and how I framed in my research pharmaceutical as infrastructure are something. Pharmaceuticals are something that can fill or make it up for the lack of proper healthcare services.
You wrote this about the privatization of the system in a study, The Work of Pharmaceuticals in Austerity-Burdened Athens, Modes and Practices of Care in Times of Crisis, where you also mentioned that in 2015, 41% of Greeks were materially deprived, unable to satisfy basic needs such as medications, rent, mortgage payments, not even food. In the same year, almost 3 million Greeks had dropped out of the public healthcare system, which you said meanwhile got slowly privatized and more linked to a private insurance system. Well, the crisis that officially ended in 2017 was only the tip of the iceberg. Please tell us if the crisis of the Greek medical care system is still present and how is it managed by the population today?
So I guess my answer to your question is quite obvious. Like 10 years of austerity meant that the welfare state was completely undone, was reformed towards in terms of privatizing services or increasing the fee to access to medical services. So even if the crisis, officially ended in 2017, it didn't actually finish on the ground. I mean, people still deal with the consequences, like real material consequences of these changes and reforms that were implemented during the official austerity period. So I suppose, and I'm saying that I suppose because I haven't done any follow-up study in Greece anytime recently, I suppose that people are still trying and struggling to meet their medical needs. To my knowledge, some of the social clinics of Solidarity that I visited during my research period are still operating. So meaning they're still offering some sort of primary healthcare and pharmaceutical distributions to people. But quite interesting, some of the pharmaceutical companies and the National Agency for Pharmaceutical Control tried to stop this grassroots distribution of medications because, of course, this meant a loss for them, economic loss from
And
them.
how did they try to stop it?
Well, I think that was maybe something that came up 4 years ago. They tried to argue with the government that the care that these clinics were providing was suboptimal and that there wasn't much control over the distributions of medication, which actually is not true because there were pharmacists, of real pharmacists, controlling the distribution of pharmaceuticals. It was the social clinics actually had put in place a very organized and safe system to make sure that people could receive good care and appropriate medications.
Could you describe maybe a bit more how these social clinics operate, how they basically work?
So, the social clinics of Solidarity at the time, in the heyday of the crisis, were about 40. in Athens and were self-organized facilities, meaning that all the people involved in their workings, running and organization were volunteers. There were in each clinic like several medical doctors that worked there for free, on a voluntary basis. Some of them were retired or had been forced to retire. And then there were like private citizens, like activists who would mostly work to ensure a smooth functioning of the clinics, like taking appointment for the patients, like taking care of registering new patients that approach the clinics. Myself, I was also a volunteer in one of these clinics as part of my research, let's say. And in my role of volunteer, I helped in the pharmacy to set up the pharmacies, to sort, order, register the medications that were donated on a daily basis, mostly. So it was like quite astonishing, the level of organization that and commitment that the volunteers put in setting up these facilities, these social clinics. And probably this commitment was motivated by a strong political stand. Some scholars wrote a lot about this moment of resistance that Greeks had against like the state, against the troika. So if you want, like the social clinic of Solidarity somehow try to resist the neoliberal reform of the state. Whether they succeed or not, this is another topic of conversation, I suppose.
But what is clear is that you and those people there know very well and learn very well what it means for a community to have a public system collapsed. During the decade of the economic austerity measures imposed by the IMF and the Central European Bank, millions of euros were invested in enforcing the police, while funds for firefighters, for instance, have dramatically been cut off. You write about the devastating wildfires in Greece as a proof of a state that has outsourced the care of the environment to individuals and collective initiatives. Tell us, are these social strategies of care complicit with neoliberalism, or are they a strategy of resistance against capitalist encroachment?
Okay, thanks. This is a powerful and complicated question to answer. The shrinking funding for welfare states, and at the same time more money given to police force or prisons is a just classic of neoliberal era. Sociologists, anthropologists, and I'm thinking about Loic Bacant, have extensively written about this passage from the welfare state to a kind of punitive state. So it's like that there is like the state doesn't provide any longer services, but enforces order and security through the enforcement of police force. So this is not unique to Greece. That's been happening all over the world, in the UK right now, or Italy quite recently, and I suppose is a general trend, very much linked or consequential to neoliberalism. So the wildfire in Athens is like wildfires in Greece. Sorry, are a old problem for the country. The new problem is that the firefighters, the number has reduced dramatically. So at that point, people have to somehow get together and find strategies to cope with or to deal with the fires that happen every summer, basically. But this is the same, if you want, process that has informed the spread, the birth of the social clinic of Solidarity, when the state is no longer present or functional. People have to find solution themselves. So about the second part of your question, whether these initiatives are complicit with neoliberalism, in a very probably intellectual way, in terms of speculation, yes, they are. But at the same time, these initiatives are those things, those efforts, those like attempts that people put in place to actually cope with the neoliberal time, I suppose. So we are caught within this very, very problematic paradox. Just like, and I guess everywhere in Europe at the moment, there is this debate going on.
So we've been discussing now about Greece. Let us ask you something a bit broader. Could you tell us more about the exploitation of the periphery by the core capitalist pharmaceutical structure? Because we suppose Greece is just one example of semi-periphery in this relation with the pharmaceutical industrial complex.
Okay, so again, I have to say that I'm not exactly an expert in this matter, but I would say that probably the southern or Eastern European periphery are those places and states, especially fragile, or some would say dysfunctional, with various dysfunctions occurring at different level in the public healthcare system, and therefore they are more vulnerable or more, let's say, prone to resort to pharmaceutical solutions. People, I mean, we are talking in a very abstract term, but yeah, people in need might resort to more easily or more frequently to pharmaceutical solutions to meet their medical needs. I was reading not a long time ago, actually, an article about like the abuse of antibiotics in Spain. Exactly in the same economic crisis period. Spain was one of the pigs country. I'm very unfortunate label, and yes, even in Spain, people in need would go to the pharmacy and ask for antibiotics rather than consulting with a medical doctor. Now, the reason why one decides to go to the pharmacy and not to the doctors are multiple. We discussed them a bit, maybe waiting list, money matter. But some would say there are also cultural reasons. So that pharmacists feel more approachable, more relatable. There is a different, probably less hierarchical exchange of, let's say, exchange as a pharmacist, at the end of the day is someone who is selling you medication is like more someone like us, if you want. So people tend to trust more or to have a different kind of relationship with pharmacists. But at the same time, people would consult also with family members or friends about what medication can be taken if one or another symptom come up. This is not necessarily the best conduct, but that's something that must be taken into account. So in this context where socio-economic and cultural factor intersects, probably pharmaceutical companies are more likely to find a favorable ground to distribute or to somehow implement the distribution of certain medications across.
And in this economic system to benefit of it.
Of course, yeah.
And this might be also a structural problem. And staying in the structural problems, we only have a few minutes left. And I want to address you the last question. And it's about this 10 months old child in Gaza that had caught polio weeks after the World Health Organization chief reported the virus was detected in the sewage system. Well, we know polio was eradicated in Gaza 25 years ago, but vaccinations plunged after the genocidal campaign started in October last year, and the territory has become a full breeding ground for the virus. Do you think, and it's a question, it might look far-fetched, but we need to address it. Do you think of the medical crisis in Gaza in the same austerity logic as we discussed it about in Greece, but this time in the context of war, or do you see them in a different frame?
Well, this question again would take lots of time to be answered in a, how to say, careful and nuanced way. I wouldn't say that what's happening in Gaza is any similar to what happened in Greece, meaning that the medical crisis was, somehow consequential to economic austerity. I think what's happening in Gaza and the medical crisis that is ensuing is part of a systematic attempt to complete genocide, to eradicate an entire population. So it's like forbidding or preventing the delivery of medical devices and medication is a deliberate decision to deprive people of the means to live healthy or to have some sort of hope for health. And there is, I guess I'm just concluding with that, there is this saying that colonization was made successful by missionaries, medics, and military. And I suppose that these three agents are still very powerful in depriving Palestine from its Palestinians from their rights to the land and to dignified life.
Thank you very much, Letizia.
Thank you. Thanks again for this opportunity. It was a pleasure.